Good morning, everyone. It's great to be here. I want to thank Erica and Natalie for inviting me to speak. This is a great venue, and I think I'm looking forward to some great conversation. I think it's a very valuable conference. I've been asked to talk about sort of a next step from the physician to the hospital to the consumer to really talk about using data in the community for health planning. And I'm going to use the example of the New York State Prevention Agenda, which is our state health improvement plan, but which is the basis for community health planning that's going on around the state. I came into public health from medicine. I was involved in a lot in epidemiology, so I've sort of done a lot of data. But the interesting thing about public health is the intersection between the science and the data and the community. Because one of the real principles of public health is to get out and into the community, learn their concerns, and then try to deal with them. And part of that process is to bring the community along with being comfortable looking at data, understanding data, the limitations of data, and really trying to use it. So it's at that intersection between sort of the science and the community that is where I do a lot of work, and I think where the prevention agenda sits. So let me talk a little bit about that. Another way to think about it is sort of turning data into information that then can be used at the community, and that's a process of sort of understanding data, looking at data, but then also correlating it with what your experience is out in the community and moving forward with it. So it's a step beyond simply accessing data. Many of the community groups probably are not going to download databases, but they need to understand what data are available and how to use it. So I'm going to talk about how we've gone about this process in New York. So the first thing to say is that data are the starting point, really, for us at the state level and at the community level in doing planning. The Prevention Agenda 2013-27 is our current state health improvement plan. It's a 5-year plan. And it basically is what we are using at the state level to guide our public health programs, the programs that put money out into the community to deal with public health issues. And it's also being used now, and we've asked the county health departments and hospitals in the state to use this as the basis for their mandated local planning efforts. Health is multifactorial, of course, so the data that we need are very broad, and I'm specifically referring to the social determinants of health, things like income, education, data on the physical environment. So the data needs to really look at health in the community are beyond the disease-specific data that we collect at the health department, and it really speaks again to this issue of partnership across disciplines. Health is so multifactorial and multidisciplinary, and the data needs follow that lead. Here's another way of thinking about how complex health is, what determines health, and really access to health care. Trying to get the pointer to work here. Access to health care on the right there is only thought to account for about 10% of health status. And all the other things on this pie chart are what we need to think about when we're thinking about health status. So genetics does play a role. We can't always intervene, but sometimes we can in genetic issues. But social circumstances and environment and behavior loom very large when thinking about health status. And so to really get a handle on what the health problems are in a community, you need to have data on these other sorts of things. So in developing the prevention agenda and providing data to the local units to do their planning, we've thought about how to get this data for them. So just to cover what the prevention agenda is, we began the development of it last year. It was a multi-stakeholder process, as public health really is. If you get out to the community level, it's not just the doctors, it's not just the local health departments, it's a much broader effort. And we developed a committee of our state Public Health and Health Planning Council, chaired by Dr. Joe Buford at the Academy of Medicine, who was a co-author or lead of the 2003 Institute of Medicine report that really got into this multi-stakeholder approach to health and to the social determinants of health. And the starting point for this committee was really to look at data, to start looking at not just health data, but the other kinds of data that I've mentioned, social data, income, education, and other things, to get a picture of health. And then, as you'll see, we selected priority areas for the plan based on the data, based on the preventability of what we were looking at. The whole focus of the prevention agenda, as the name suggests, is prevention. We're not really delving into health care as much as we are trying to figure out the conditions under which people can live healthy and make policy changes to move us in that direction. So we selected priority areas of the plan based on this and the availability of evidence-based interventions. And we are using this plan as part of our move to have the state health department accredited through the new national accreditation process for state and local health departments. This slide is an example, shows you the kinds of partners that we needed to get involved in this process. We involved in our oversight leadership group leaders from healthcare, business, academia, community organizations, local health departments, really the gamut, because public health is a team sport. It's not just something that health departments do. The idea of community engagement is critical, and even with these groups, I think we needed to talk through what the data are, what is available, what the limitations are, and get people comfortable with the idea of looking at data and thinking about data, and then turning that data into information, asking the questions of the data, which I think any of these groups can do. So the overall goals of this effort at the community level were to improve health status with a big emphasis on health disparities, the differences in health status that relate to race, ethnicity, income, educational background, disability, and other sorts of things, and to get people to think about a health in all policies approach. And this is where you need a lot of stakeholders at the table. If a problem in the community is a lack of safe places to get out and exercise and walk and bike lanes, then you need not only the public health department, you need the police, you need the transportation and other entities to really get involved and to think about the health implications of the policy changes that they're making. So in that sense, we need to take the data that we have and move it even beyond our local health interested partners to others and get them thinking about what they're doing. We wanted to strengthen the public health infrastructure, and I think the process that the local health departments are going through, we've done webinars with them about how you look at your data, how you tap into this big data stream, which can sometimes seem like drinking from a fire hose. So we need to really work through people, how you get a handle on this and use it practically for practical purposes. The whole goal of public health really in this plan is to create and strengthen sustainable partnerships, public-private partnerships, multi-sector partnerships, and over the 5 years of the prevention agenda, we hope to really advance that and really further strengthen and promote the case for investment in public health and prevention. There is a return on investment in prevention. You can demonstrate it, but it doesn't happen overnight, and that's sometimes a hard message to get across. Our vision was pretty simple in this. We would like New York to be the healthiest state. And we divided the priority areas after a number of months of sifting through the data with this interdisciplinary group into 5 areas: preventing chronic diseases, promoting a healthy and safe environment. And when you talk about environment, you do get into issues like zoning and traffic and other sorts of things, the environment that people live in. So the kinds of data you might think to look at maybe are not your traditional data that you think about when you're thinking about health. Promote healthy women, infants, and children. Promote mental health and prevent substance abuse. And the 5th category is essentially the preventable infectious diseases. How do we make further advances in those areas? And for each of these areas, we then broke out some health-specific goals that we wanted to reach, and I'll show you an example in the chronic disease area, but really based very much on data, vital records data on births and deaths, hospitalization data, disease-specific registry data. So there are a lot of disease-specific data that come into play here, and we use those as our ultimate outcome measures. But in between, we have developed measurable objectives and then tried to sort through the interventions. And here we've thought about interventions by sector, so not just the health sector, the healthcare sector, but the educational sector, the transportation sector, the business sector, the educational sector. What are interventions and policies that impact health that we can try to push in those areas? And by levels of the health impact pyramid, which essentially is the idea that at the base of the pyramid of health, we're talking about the social determinants of health, the social economic status, which is not something an individual physician or even an individual health department can influence, but which society needs to get a handle on, and to get people to understand that social economic status is really a driver of health, and policy change at that level can make a huge difference, up to the peak of the pyramid where we're dealing one-on-one with a patient around smoking cessation or something else. So the idea that at each level of that pyramid there are steps that you can take, things that you can do to get at that. In selecting the interventions that we suggest, we very heavily, again, went with the evidence base. And also with promising practices, next policies, things that are not quite evidence-based yet but make sense and are worth trying. We assessed for everything the focus on health disparities, so we have huge differences in health status based on social economic type factors. So how do we start to address that from a health context? Our ability to measure success was key in the time frame that we're talking about here in selecting interventions, and the potential reach and potential for broad partner support and collaboration. So all these things went into developing the plan. We then have taken this as a state-level plan, but as I mentioned, we have authority over the local health departments and hospitals, and we've asked each of them, I've given you the citations here from the statute, to develop a local plan, and actually, you know, we have required hospitals and county health departments to do this. We asked them to do it together this time, sort of a unique idea, but to really try and get some synergy there, and to pull in all the other stakeholders in the community who we don't necessarily mandate things of, such as the educational sector or other sectors, and involve them in developing a community plan. Those plans were due to us last Friday. We do actually have most of them in, and we'll be evaluating them, but this effort is not just ending with the submission of a plan, but to have the counties then track and use the data, the kind of data we're talking about here today, to then monitor their progress over the 5-year period, the lifespan of this plan, to get a sense. So again, data comes in not only in the identification of the problem, in the identification of potential solutions, but also in the evaluation of where you're going and the steps that you need to take. So the CHAs and the CSPs, these are the community health assessments that the counties are doing, and the community service plans that the hospitals are doing, as I mentioned, due just this past week. And we've asked them to work together on at least a couple of priorities to actually do some initiatives around, one of which addresses specifically a health disparity, one of these differences by race, ethnicity, education, social economic background, to address it in that way. And Jim Nickman is here. The New York Health Foundation has generously put up $500,000 for the counties to apply for with local matching funds to try to implement some of these local initiatives. And as soon as we've done a quick read-through of the plans that we've got, the counties will be submitting letters of intent. So there's really some meat behind this. We will be able to really get some traction in a number of communities and move things ahead. And hopefully, even in the communities that don't get funded, start a conversation with their local philanthropies, their local businesses around getting the resources that they need to implement some of these things. So all that from starting looking at the data and trying to move forward. We have been doing, in addition to that, we have been doing webinars, and thanks to Haney's and some of the other partners, statewide partners, for helping us do this, but a number of webinars bringing the locals together to talk about data. How do you access data? How do you look at data? How do you think about data? How do you ask questions of it? And turn that data into information then that you can use at your level to decide where you want your priorities to lie And then the next step is, as I mentioned, evaluating how you're doing. So we will have annual updates of the main data measures, but we hope through efforts like this to educate the locals around data use and the availability of data on our website now, that we will encourage them to get much more engaged with that, and we will be tracking that, their access to this as we go along. So just some quick examples of the specifics within the plan. These are the three main areas around preventing chronic diseases. The first is to reduce obesity in children and adults. Obesity, of course, a major public health issue. One that we've actually gone out and created new sources of data just in the last few years to gather. So just recently we've started collecting obesity data systematically from schools and have reporting that data on our website, on the Health Data New York website, so that school districts and counties can then go in and look at their data and start to get a sense of where their problems are, and hopefully use those data as a jumping off point. The data are quite striking in terms of the numbers of proportions of kids obese in different age levels, and hopefully that will generate some action and some real thinking at the local level as people start to see that. A second area is reducing illness, disability, and death related to tobacco use, a continuing issue. And our tobacco data, we do survey data on this continuously. Those data are up on the website and downloadable and analyzable in more detail than we can do, in just straight up tabular form in reports. So again, we hope people will start to use this. And finally, access to high quality chronic preventive care and management in clinical and community settings. So this is increasing screening rates. Again, data to track how screening is being done, and the all-payer database would be a great boon to that when it's available for us. So these are examples. These are the three main core areas in chronic disease, and how the data that we have has been used to identify these, but also to track what's going on. Hard to read this, but these are the specific percentage goals that we've selected. By 2017, in many cases, it represents about a 10% decrease, or the Healthy People 2020 goal, whichever was more ambitious, we went with. And so these are sort of the score. This is the scorecard that we will be updating annually as we move through this. So this is our picture of our website. Data is front and center on the website. The far right arrow, the Health Data New York button. So it's not hard to find these data. Just go on the website and click the light blue button or the dark blue button for the prevention agenda, which gets you into the more detail of each of our goal areas and where we're headed with that. We do have CAN data on the website. So, for example, percentage of adults who are obese by county. These are our telephone data from the Behavioral Risk Factor Survey. Again, that database is on the website, downloadable or analyzable with the tools on the website, so you can go in and do your own, but we do have some basic information here, and you can see there's quite a bit of variability in these data from county to county. And this is actually the Health Data New York page, where this, again, to make the point that the same data are available in raw form, if you will, so you can do ad hoc analyses. And one of our efforts through this process with the prevention agenda, with the webinars, has been to try to bring people up to speed to how to get on and use these tools, because I think there's a training curve that needs to go through, and people need to get comfortable with it. But that's the actual data are also there themselves. So this was all launched back in April down in New York City, and there's some links on the slides to a nice news story we got out of that. Take my word for it that this news article from the Chinatown News relates to the prevention agenda. I at least know Dr. Shaw's in the picture, so I assume that's what it's about, but somebody could help me translate. But this just to make the point, this is really so multifactorial in New York between the different entities and the different populations that we deal with that it's stunning sometimes. But I love this, so I have to show that. And we actually did a whole hour broadcast on the Public Health Live, which is our state public health grand rounds, monthly. If you're not familiar with it, check it out on the website. But we did a whole session on the prevention agenda. Dr. Shaw, Dr. Buford spoke, and this is archived as well if you want more information about it. So thank you very much.